Nosocomial spread of SARS-CoV-2 has been a huge burden on fragile patients and healthcare workers since the beginning of the pandemic. In this study, we evaluated the risk posed by hospital-level work organization on epidemic spread. We were provided with infection data as well as extensive staff sharing data by a 24-ward psychiatric hospital in France. We fed this data to a stochastic multi-ward compartmental model to simulate virus transmission. Patients and healthcare workers of each ward were modeled using an extended SCIR model that also accounts for asymptomatic transmission, and the connections between the wards were determined by staff sharing data, enabling us to define our complete model illustrated by the following graphical network. First, we assess the epidemic potential of each ward, with each ward acting in turn as index ward. Here, for example, we have ward A2, which is the point of origin of infection, and we compute the probabilities of epidemic spread in other wards. On the graph on the right, we see the relationship between the degree of the index ward and the number of wards where infection spreads in a span of 40 days. We see that the higher the degree of the index ward, the more widespread the contamination. Next, we looked at the impact of staff sharing on epidemic spread. In green, a limited sharing scenario. In blue, the observed staff sharing scenario, and in red, an oversharing of staff. We first see that the space of red in the upper Y values indicate frequent widespread contamination when staff are overshared, whereas limiting staff sharing can lead up to at most 5 infected wards. Next, we also evaluated two infection control strategies, namely an isolation ward to isolate COVID-19 positive patients, which can reduce transmission up to 60% in high community prevalence settings. However, a screening area prior to patient admission seems ineffective as long as an isolation ward is active. The take-home message here is that staff sharing plays a crucial role in the spread of the epidemic in healthcare facilities and should be taken into account.